Hi, I'm Dr. Harrison Carter, and what I'm about to tell you could quite literally save a life. Welcome to another episode of the Hidden Medical Thoughts podcast, where we uncover the truths your body wishes you knew. Every 6 minutes, someone over 60 suffers a stroke that could have been prevented. Behind that number is a real person, a story that didn't have to end. And shockingly, the cause is often hiding in plain sight, inside your medicine cabinet. So today, let's talk about 4 everyday medications that may be silently increasing your risk, and what safer options you can choose instead. Did you know that every 6 minutes, an elderly person suffers a stroke that could have been prevented? It might sound like just another statistic, but behind that number is a grandmother who will never tell stories again, a father who can no longer walk through his garden, a life that could be extinguished in an instant. And here's the most alarming part. A new study revealed that many of these tragedies are linked to the improper use of 4 very common medications, drugs you probably have right now in your medicine cabinet, prescribed with the best of intentions, but whose hidden dangers are now coming to light in a deeply concerning way due to how they're being used. And pay special attention to one of these drugs, the one that frustrates me the most, because millions of people take it daily thinking it's harmless, when in reality, it can drastically increase, even triple, the risk of having a stroke, also known as a cerebrovascular accident, or CVA. If you're over 60, or if you care for an elderly person, let me tell you, this is no exaggeration. What I'm about to share could truly save a life. And even more importantly, I'm going to reveal safer alternatives to protect your brain health and avoid the damage these medications may cause. Let me explain what happens in your body when you suffer a stroke. Imagine your brain as a city. Neurons are the houses, and arteries are the streets that carry oxygen and nutrients, the essential fuels that keep everything running smoothly. A stroke happens when traffic in one of those streets suddenly stops. And this can happen in 2 ways. The most common type is called an ischemic stroke. This means that blood flow to the brain is suddenly blocked by a clot in an artery. Without fuel, the houses, the neurons in that area start dying within minutes. These patients often also have cholesterol plaques clogging the arteries in their neck, heart, or legs. Now, the second type is a hemorrhagic stroke. In this case, part of the circulation bursts, perhaps due to a weakened artery or an aneurysm, causing blood to flood the brain tissue, compressing and damaging it. Both scenarios are catastrophic, and as we age, our brains become more vulnerable, especially in people with uncontrolled health issues like high blood pressure or diabetes, and also those who misuse the medications I'm about to discuss. Let's start with our list. Number 1, non-steroidal anti-inflammatory drugs, or NSAIDs. This group of medications is perhaps the most popular in households. Drugs like ibuprofen, diclofenac, naproxen sound familiar? They're the go-to solution for headaches, back pain, or that morning arthritis stiffness. We buy them over the counter, pop them like candy, convinced they're safe, and that's exactly where the danger lies, in their innocent appearance. See, for a young person with a strong heart and kidneys, taking ibuprofen occasionally isn't a big issue. But for someone over 60, especially if taken daily or at high doses, it's a completely different story. They go from being helpful allies to becoming serious risks. But why is this so dangerous? Here's what happens inside your body when you use these medications without proper control. First, they increase your blood pressure. Think of your arteries like a garden hose. Blood pressure is the force with which the blood flows. NSAIDs cause your body to retain sodium and water, increasing the volume of circulating blood. At the same time, they can make your arteries stiffer. The result? More fluid pushing against narrower, harder artery walls. That's why blood pressure spikes. And today we know high blood pressure is the #1 risk factor for a stroke. It's like overloading the pipes in your house day after day without noticing. Sooner or later, one of them will burst. Now listen to this. The second way these medications can harm you is more subtle. They affect your kidneys and your platelets. Kidneys are your body's master filters, and NSAIDs can damage them, especially kidneys that have aged or have been worn down by poor habits, an inflammatory diet, or improper hydration. Plus, NSAIDs can increase clot formation in places where it shouldn't happen, like your brain's circulation. And pay close attention. When used long-term, these medications promote chronic inflammation in your artery linings, especially if your diet is high in sodium, ultra-processed foods, and you drink little water. That inflammation acts like sandpaper, constantly scraping the inside of the arteries, creating rough spots where cholesterol sticks and forms plaques. And a piece of that plaque can break off and travel to the brain, triggering a disaster. So what's the solution? Do we just live in pain? Absolutely not. The key is strategy. First and always, never stop any medication on your own. That can be just as dangerous. The solution starts with an honest conversation with your doctor. Ask directly, "Doctor, considering my age and blood pressure, is this the safest medication for me? What's the minimum effective dose I need, and for how long?" And we must explore alternatives, including natural ones that can be very effective. One non-natural option for chronic pain is acetaminophen, paracetamol. It's generally safer for the heart and kidneys. There are also anti-inflammatory gels and creams, like diclofenac or ibuprofen, that work directly on the pain site, minimizing systemic risk. And don't underestimate the power of physiotherapy, acupuncture, and controlled physical activity. In many cases, moving more is more effective for pain control than staying still or taking the wrong medication. Now, if we're talking about natural options, we have some powerful tools. Turmeric, for example, has proven anti-inflammatory properties. It can be used in powdered form as part of your daily meals, in soups, smoothies, salads, combined with a pinch of black pepper to enhance absorption. The recommended dose is usually between half and 1 teaspoon a day, 1 to 3 grams. For those who prefer capsules, many concentrated supplements offer effective doses of around 500 to 1,000 milligrams daily, but always under medical supervision, especially if you're on other medications. And here's another natural alternative: aloe vera ointments, which have a calming and anti-inflammatory effect directly on the affected area. These can help relieve joint and muscle pain without overloading the body with substances that increase blood pressure or harm blood vessels. The goal is not to suffer or self-medicate recklessly, but to find the right balance between relief and protection. Now let's move on to the second group of medications that many people take daily without realizing they may increase the risk of stroke. Many people use them for a very common but rarely discussed problem: urinary incontinence. When we talk about overactive bladder or urinary leaks, this affects millions, especially older adults. The fear of having an accident can limit people's lives. They stop exercising, avoid social outings, and may even hold back from laughing freely. To manage this, many turn to a group of medications called anticholinergics. Names like oxybutynin or tolterodine might sound familiar. These drugs help relax the bladder and prevent leaks. And yes, they can be quite effective. But what few people know is that these medications can directly impact brain health and significantly raise the risk of a stroke. And that's where the real danger lies. Here's what happens. When you take these medications, they block a natural substance in your body called acetylcholine. Acetylcholine is a key messenger responsible for muscle function, including the bladder. But it's also essential for memory, focus, and thinking. It's like the oil that keeps the brain's gears running smoothly. The problem is that these medications don't just work in the bladder. They circulate through your entire system, reaching your brain as well. And they can block acetylcholine there too. Over time, this can cause confusion, memory loss, dizziness when standing up, or drowsiness during the day. Many people mistake these symptoms for signs of aging, unaware that the pill they're taking for bladder control might be silently shutting down their mind. But there's something even more concerning. Blocking acetylcholine can also interfere with blood flow to the brain. The arteries become stiffer and lose their ability to dilate properly when the brain needs more oxygen and nutrients. This can create low-flow zones in the brain and increase the risk of stroke. Add to that the fact that these medications can cause dizziness, sudden drops in blood pressure, and falls, and the risk becomes even greater, especially in older adults or those with high blood pressure. So, what can you do if you're taking one of these medications? First, check the name of the drug. Ask yourself, is it an anticholinergic? If you're not sure, don't worry. Look it up online or call your doctor. And here comes the most important part. Ask your doctor directly. Could this medication be affecting my brain? Is there something safer for someone like me? And the good news is, yes, there are safer options. One of them is a newer class of drugs called beta-3 agonists, like mirabegron. They work differently, don't interfere with acetylcholine, and have a much lower risk for the brain. For many people, it's a safer choice. But not everything has to be solved with pills. There are natural and highly effective strategies for this issue too. For example, Kegel exercises help strengthen the pelvic floor muscles and improve bladder control. Bladder training, going to the bathroom at scheduled times, can help retrain your urinary reflex so you don't feel the need to go constantly. And don't underestimate the impact of small lifestyle changes. Reducing caffeine, alcohol, and carbonated beverages can make a huge difference. Urinary incontinence needs a solution, absolutely. But that solution should never come at the cost of your mind or increase your risk of a stroke. And now that you've learned about two very common medications that can harm your brain, let's move on to the most critical part of this message. Let's talk about drug number 3, the one many see as a miracle, but that hides a dark secret: oral corticosteroids. I'm talking about medications like prednisone or dexamethasone. If you've ever had a severe asthma attack, bronchitis with heavy mucus, an autoimmune disease, or a strong allergic reaction, you probably know what I'm talking about. In just a few hours, these drugs can reduce inflammation, lower your fever, ease your pain, and help you breathe better by opening your airways. But here's the truth. Using corticosteroids for long periods and without proper control might bring relief today, but will hand your body a very steep bill to pay tomorrow. And that's not an exaggeration. One of the highest prices? A dramatically increased risk of stroke, especially if the brain is already vulnerable or weakened for any reason. Why? Because corticosteroids don't just act on one part of the body, they impact multiple systems at once, and that can destabilize your entire organism. I call this the corticosteroid triple threat. Watch this. They raise your blood pressure. Corticosteroids make your body retain sodium and lose potassium. This increases blood volume, making your heart work harder. They raise your blood sugar. They interfere with insulin and can cause what's known as drug-induced diabetes, even in people who have never had diabetes before. And this excess sugar damages the arteries from the inside, making them both stiff and fragile. They alter your cholesterol and thicken your blood. Corticosteroids raise LDL cholesterol, commonly known as bad cholesterol, and make the blood more prone to clotting. This creates the perfect storm for a stroke: damaged arteries, high blood pressure, elevated sugar levels, and thickened blood that can clog an artery at any moment. So, what should you do if your doctor prescribed you one of these essential medications? The answer is not to stop taking it. The key is to use it intelligently and with extreme caution. That means having a clear conversation with your doctor. Ask, am I taking the lowest effective dose for the shortest necessary time? Are there other treatments that could reduce my dependency on corticosteroids? In cases like asthma bronchitis, or chronic mucus conditions, many patients can switch to inhaled corticosteroids, which have fewer side effects on the rest of the body. And for diseases like arthritis, there are other medications that can eventually reduce or even eliminate the need for corticosteroids altogether. Plus, there are natural options that can support this process. Turmeric, when used in food or capsule form, helps safely reduce inflammation. And green propolis extract, known for its immune-modulating and anti-inflammatory properties, has shown promising effects in chronic diseases. Now, if continuing corticosteroids is the only option, then you must build a protection plan in parallel. That means monitoring your blood pressure, sugar, and cholesterol much more closely. Eat with minimal salt, avoid refined sugars and ultra-processed foods, and move your body daily. That's non-negotiable. When you're on these medications, your body, especially your brain, needs more care than ever before. Now, we've arrived at the most dangerous medication for the brain because it's one of the most misused. Let's talk about antipsychotics. I saved this group for last for a reason. It's the one that carries the highest risk, and tragically, it's also one of the most frequently misused among older adults. Medications like risperidone, olanzapine, or quetiapine were originally created to treat severe psychiatric disorders such as schizophrenia. In those cases, when used correctly, they can be life-saving. But what we're seeing today is something very different. More and more elderly patients are being prescribed these drugs outside of those original indications, sometimes to manage symptoms like agitation, anxiety, or aggression in patients with dementia. And even more surprising, there are people taking these medications chronically just to sleep better, even though they don't have any mental health conditions, and often without ever trying safer strategies first. In an overburdened healthcare system, this seems like the easy way out, a pill to calm the patient. But in reality, it's a silent danger. Some of the world's most important regulatory agencies, like the FDA, have issued their strongest warning about this class of drugs, the black box warning. And the reason is crystal clear. When misused, these medications nearly double the risk of death in older adults. And the risk of stroke, it can triple. Why does this happen? First, they cause sudden drops in blood pressure when standing up, what's known as orthostatic hypotension. That can lead to falls, fractures, and more seriously, brief episodes where the brain doesn't get enough blood. When this happens repeatedly, it can trigger a stroke. Second, they can disrupt the heart's rhythm, causing arrhythmias. This increases the risk of blood clots forming, and those clots can travel to the brain and cause a cerebral infarction. Third, they alter the body's metabolism in aggressive ways. They raise blood sugar, increase cholesterol, cause rapid weight gain, and can induce diabetes in just a few months. And if that weren't enough, there's new evidence showing they also thicken the blood, making it more sticky and prone to forming clots. So, what can you do if your loved one has been prescribed an antipsychotic for dementia or agitation? In that case, you must be their advocate. Ask the doctor firmly, "Doctor, have we tried every non-drug alternative first? What is the plan to take this medication away as soon as possible?" Because yes, there are other ways to treat agitation in dementia, and most of them are not found in a pharmacy. The real first step in treatment is to understand what's going on with that person. Are they in pain but unable to express it? Are they dealing with an infection? Are they scared, confused, or simply bored? Very often the answer isn't a pill, but an unmet need. Creating a peaceful environment, playing music they enjoy, simplifying their daily tasks, speaking to them with kindness, validating their emotions. All of these things take more time than writing a prescription, but they're infinitely more human and far safer. The use of an antipsychotic in an elderly person should always be a last resort, and only for a limited time, once all other approaches have been tried. Never for convenience, never as a quick fix to help someone sleep. because the price of that so-called peace could be a devastating and entirely preventable stroke.